Hi, this is Junaid, neurocritical care stroke and epilepsy specialist. Today we're going to enter the new module, which we're going to discuss virtual care. Believe it or not, virtual care is going to be a significant part of your practice of the future. So when you're deciding on choosing your specialty, you need to take that into account, as is one of the major ways in which care will be delivered in the next decade and beyond. Now look, everyone keeps talking about virtual care is just here for a COVID thing and then it's going to go away. That is not the case. Telehealth or virtual care is the key to digital health 4.0. And the reason behind it is that if once your front door, when you enter into the healthcare system by itself, if that door itself is digitized, then the rest of the building, the rest of the system can eventually be digitized itself. So that is why I always say that telehealth is the key to enter the digital front door of the healthcare 4.0 system. And that is the only way we can move forward to the real future of digital healthcare 4.0, a dream that can be realized. Let me explain more. Look, clearly, of course, COVID was the only silver lining of COVID was where the virtual care was considered now the norm rather than a simple offset used by some subspecialties, etc. But now there was a 50 times growth to 175x growth within the COVID. The levels have come down again and they will stay up around 37x to 50x for the rest of the future. Again, there is always going to be an issue how the policies and procedures are going to follow. But now the genie is out of the bottle and it is here to stay. No questions asked. The real important thing is that we have discussed in our prior lectures, especially when we were talking about the whole paradigm shift of digital healthcare 4.0, is understanding that how digitization to digitalization and then digital transformation happens. We're still at the stage of digitalization, where basically simple processes are now turning into new forms of experiences. When it's all going to come together, we're going to see a true transformational change of digital healthcare 4.0. And as I said, we are now still at a very beginning of true digitalization of healthcare. The real important is that we have seen that there is a curse of dimensionality with the healthcare data. The issue really is that at some point in time that needs to be brought together. And it is slowly getting together and more faster and bringing new insights for patients' disease processes, chronic disease management, etc. Of course, we have a significant amount of disease data itself, right? Radiomics, clinomics, genomics, etc. And then we also have new forms of data that are coming through because of our wearables, like Apple Watch health data, etc., which are increasing in the amount of sensors, the accuracy of sensors, and the ability for them to be monitored longer periods of time. So generally speaking, we have the disease data, and now we have the health data to accommodate, and then we can combine those insights. Not to mention, we have claims data and other forms of data like clinical registries, virtual clinical trials, etc. They are bringing more and more digital data into the market itself. And when there is this combination of data, we will need AI to actually support it, which is going to be the next module. So stay tuned, and we're going to basically talk about artificial intelligence and healthcare within our next modules. So clearly this digitization needs to happen. It is not something that is actually, we can live without. It is a necessity in this digital age and not just an optional service. Now, what is the true value of digital health? The true value of virtual clinical care comes from the remote patient monitoring. The remote patient monitoring has two different aspects to it. One is just remote patient monitoring, which is objective measurements of physiological data like blood pressure, pulse oximetry, etc. But more importantly, we're getting into the game of remote therapeutic monitoring, in which both two things comes in: the pharmacological medication monitoring and the new forms of digital therapeutics that are coming online, and that's monitoring itself. Both of them have been reimbursed by CMS. So now we actually have a pathway where physicians can be reimbursed for providing these services. And once there is a reimbursement pathway, then eventually this can become a norm. Not to mention other countries like Germany, Belgium, etc. actually have applications that can be prescribed by physicians. So still, the United States is lagging behind in these services, but we're going to see more significant expansion of these services. And the benefits that are going to come through that, we're going to discuss in our next module as far as systemic benefits of telehealth. Thank you so much for listening.